The patients are always first. It's the patients that drive everything that we do. And we see that we make a difference. When somebody says to you, you gave back my words, you gave my ability to experience emotions and feel again, that drives my passion. I think when you work with people, you are surrounded by people that you know the patient is number one, that everybody is here for the same reason and it's genuine. I think that, that is an amazing place to be. I'm Dawn Neumann and I am the research director here at RHI. Also an associate professor at IU in the School of Medicine and the Department of Physical Medicine and Rehabilitation. So in terms of my research, a lot of what it focuses on is getting people with brain injury better emotional health and better emotional well-being. Because emotions are so complex and difficult to study, a lot of people tend to shy away from it, and it tends to be something that's really understudied, but yet something that's so important. It's something that we see so frequently and something that's a chronic issue after brain injury. And so that's why I wanted to go into this area and study emotional problems after brain injury to help kind of reduce issues with the anger and aggression that we see, issues with depression and anxiety that are impacting not only the person with the brain injury, but kind of rippling out to their family and friends as well. You never know when you're going to walk out your door and get in your car and your whole life can absolutely change in an instant. And we see this so often with our family and friends, and I think this is why it's such an important mission for me, because it's just, I would see these patients all the time, and then here you are talking with them and their whole life has completely flipped upside down and they're no longer who they were. They are a different person. And you're right that it can take a long time for research to turn around and impact care. But I think that's one of the things that I appreciate so much about RHI, and I think it's one of the things that we do exceptionally well here. One of the first things that I did in my research, I was working on teaching people with brain injury how to recognize other people's emotions. But honestly, I think it's something that we take for granted all of the time. We have to interact with our spouses or family members. If we can't tell that they're sad or they're angry, that's really going to affect how we respond to that person. Can we empathize with that person? Are we going to be emotionally supportive and respond to their needs? This issue of having a problem recognizing how other people are feeling, this can happen in up to 50% of people with brain injury. And so we developed a treatment program for this. And we did this international multi-site study, and we wound up finding out, hey, the program that we put together, it is helpful. It helps people better recognize how other people are feeling, and it made a difference. So it was from these interactions with the clinicians that prompted us to develop a standardized treatment for teaching patients with brain injury how to reconnect, how to feel those emotions, to pay attention to those body cues, to give them a vocabulary for their emotions. And we did this, and it's interesting because just by giving them a vocabulary, by enhancing their awareness, we actually wound up finding that it reduced their anxiety. They had more positive emotions. It improved their overall emotional control. It reduced their anger. So it was just by giving them this skill and this ability, it actually helped in all of these other areas. It had kind of this trickle-down effect. These principles were incorporated into teaching patients how to interact with their spouse better, how to recognize their own emotions and communicate their emotional needs, how to recognize their spouse's emotions and be able to meet their spouse's needs. So this is a program now that exists clinically. It's through the RHI Foundation that we have been able to do some really important preliminary research that has led to federal funding. And so that have advanced to these clinical programs. So without that, our chances of being successful at getting federal funding would really be much more limited without these donations. We have a lab here at RHI. It's called the Interface Center, and essentially it's all looking at human interactions and emotions, and it looks like a beautiful living room setting. And it has the coolest, highest technology that is not housed anywhere else in the world under one roof. We are doing things that are not being done at any other university, academic facility, rehabilitation hospital, anywhere. But to do that, it costs a lot of money to have that type of equipment, and that is why we need the funding. You know, we had to decide, where are we going to put this? You know, it was either going to be at IU or RHI, and RHI said, we want that here because we support what you're doing. This is amazing. And, you know, to be in a place that really sees, you know, your value, it's phenomenal. When you're doing research, you're touching many lives at a time. When you disseminate this, when you get out there and you go to conferences and you write these papers and you know that people are reading it, but it's amazing that what we're doing here is just growing and it's impacting people around the globe, and it's phenomenal.